Hey everyone, Dr. Lewis here with Dr. George at KSF Orthopedic. We are here to kind of return with our frequent sports series where we talk about topics in sports, orthopedic medicine, so that our patients can follow along if there's any similarities with their conditions. So today we're going to talk with Dr. George about Drew Brees, future Hall of Fame NFL quarterback, is retiring or has retired already. After an illustrious career, many accolades. However, he did not get through all those seasons without some significant injuries. So I'm going to punt that over to Dr. George to talk more about everything he went through.
Amazing career. Yeah, amazing career. What he did for the city of New Orleans. I mean, it was great to watch him. But, early in his career, he had a very bad labral injury. That shoulder labrum was torn, and he had to have surgery, and that really ended up saving his career. And he went on for years and years. So I just wanted to talk just briefly about what the labrum is and what symptoms related to labral tears and how you can fix it. So I have this little picture. We'll see if you can see it on the screen. I'll try to get it up close. So the labrum is this rim of tissue here that goes around the socket. And it's also the attachment of the biceps tendon. So I won't hold that up too long, but the biceps muscle has a tendon that goes inside the shoulder right underneath the rotator cuff, and then it attaches to the labrum. So the labrum is a soft tissue ring around the socket of the shoulder joint. Shoulder's a ball in a socket like a golf ball on a golf tee. Mm-hmm. So there's a couple different kinds of tears that you can get. A tear in the top of the labrum where the biceps attaches. That's called a slap tear. Slap, S-L-A-P. That means superior labrum anterior to posterior. That happens more in overhead athletes because when their arm goes back in that cocking motion, that area kind of gets twisted, and overuse can cause tears there. So slap tear. You can also get a degenerative slap tear, so older people will get that as well. And then a tear in the front is usually from instability, where your shoulder dislocates, comes out of socket and rips the front of the labrum off, and that's called a Bankart tear. Okay. So those are treated differently. Degenerative tears, usually you can get by without any kind of surgery. You can just try the non-surgical things, injections, therapy, anti-inflammatory medications. For overhead athletes who are having more pain related to slap tears, then that can be fixed arthroscopically. We just make 3 little poke holes and repair it back down to the bone. Okay. The Bankart tears, the ones in the front, if those cause instability where the shoulder is either coming out of socket or feels like it wants to come out of socket repeatedly and doesn't get better without surgery, those people also can be fixed with arthroscopic procedures. So again, 3 little poke holes, repair it back down, get that shoulder nice and fixed up. And for Drew Brees, it sounds like he had a tear of the entire labrum.
Oof, yeah.
So he had kind of slap, Bankart, posterior, everything, and that can happen in high collision athletes. Mm-hmm. And so he had arthroscopic procedure, and then that saved him. So those are kind of the scenarios that you need to fix the labrum.
Well, not that we see Hall of Fame quarterbacks in our clinic every day, but for, like you said, just kind of maybe more of our patient population or the followers who are watching as well, who happen to have some kind of labral tear, whether it's sports related, degeneration related. You mentioned an arthroscopic procedure, which is done with a few small incisions and a camera. What can the recovery time look like after that?
Yeah, it's a great question. So usually that's it's outpatient surgery. Usually takes about an hour. Sling part-time for 6 weeks, where you can take it off for anything in front of your body. You can write and type, so you can still do schoolwork. You can still work, desk work and things like that. Total recovery is 4 months. For most of those, for contact sports, so say you want to go back to football, wrestling, something like that, that's 6 months for contact. So it is a lengthy recovery. The good news is the recovery is really good. Mm-hmm. Patients do really, really well. So another topic we wanted to talk about. So Tiger Woods also in the news.
Right.
Horrible wreck, horrible leg injuries. Don't know the exact details of that. And hopefully he won't have any chronic pain. But as you know, a lot of people can get injuries, can get all their bones, their soft tissues, all those things can be repaired, and you still end up with chronic pain.
Yeah, exactly.
So can you just talk about your approach to, hopefully not Tiger's situation, hopefully won't have any pain, but patients who are in that scenario?
Yeah, and this is just a unique scenario because we don't know all the details, but we do know is just that Tiger Woods had multiple fractures throughout his one of his legs, including his foot, ankle, shin bone, required extensive surgery, debridement. And I think this would be a good opportunity just to kind of piggyback into what I like to call a multimodal pain regimen. So that's where, say you come in and you have surgery like Tiger Woods, or an outpatient surgery where you have your knee replaced, or maybe even a labral repair. Whenever you have any kind of surgery done, there's going to be, just damage to soft tissues, bones, nerves, that has to happen in order for the procedure or the surgery to move forward. So those things heal up over time. And more often than not, you have a relatively uncomplicated post-operative course. You may have a little soreness, have some medication to get you through, but every now and then you might have some numbness or some tingling, some burning that occurs at the site. So when I see patients like this post-operatively, and I'm sure Tiger Woods is probably having to deal with this since he's so fresh off of his surgeries, but we like to employ this multimodal pain regimen. And what that means is when we think about pain, pre-surgery, even post-surgery, there's a few different components. There's inflammatory pain or inflammation that happens with any kind of tissue or bone damage. And then there's also nerve damage. When you cut the skin, you're cutting small nerve endings. It's something that has to happen. This can result in that numbness or the burning that you feel post-operatively. So we like to use medications that address both the inflammation. These would be anti-inflammatory medications. And then we also have nerve medications that help kind of stabilize those free nerve endings. We call these neuropathic medications, the likes of gabapentin, Lyrica, sometimes
What about topicals?
Topicals, in my mind, they're very safe medications. Sometimes they can be a little expensive if you're kind of getting into more exotic topicals. Mm-hmm. So if you have a compounding pharmacy, that might be something that we do look into here. But a lot of time we talk about are just anti-inflammatory topicals. Mm-hmm. So we're talking about Voltaren gel, which is just a topical or an ointment version of an anti-inflammatory medication. So I usually like to wait to use topicals in the acute post-operative setting because we want wounds to heal up clean and nice, and we don't want anything getting in and getting infected. But yeah, once we have our healthy scars, then we can use topicals as well. And that would be another kind of a third prong between the nerve medications, the anti-inflammatory medications, and now we've got the topicals. So we want to utilize as many different types of medications that we can so that we have to limit the dosage of each one of them, and with higher doses come higher side effects. So that's how I generally like to employ a multimodal pain regimen post-operative.
Great.
So we will be coming back soon with another video. Try to shorten this one down a little bit, keep everyone engaged, and we look forward to seeing y'all then. All right.
Yeah.